Hello, everyone, and thank you for tuning in for another exciting opportunity to get some education, motivation, and inspiration here on the National Optometric Foundation live show. Today, our topic in the month of June is going to be centered around men's health, and it's important for men to know when they should go in to see their physician, when they should go in to have their eyes examined, and maybe what some risk factors involved when it comes to their eye health, their heart health, and gastroenterology. So I am excited to have some distinguished men with me tonight that's going to be sharing some great information on those topics that I just spoke about. And I'll introduce them to you next, but I want to just let you know about the National Optometric Foundation and what it is that we do. I am the treasurer for the National Optometric Foundation. We are the financial arm, the supporting arm to the National Optometric Association. And in various ways, we try to support them by helping with community activities, scholarships when it comes to supporting our students that's thinking about going to optometry school, some of our students who are currently in optometry school, supported some of our doctors, supporting the community, underserved communities with free eye exams, free glasses that we do each year when we have our National Optometric Association convention. We are excited to say that we have had great support from a lot of companies who have given finances to the National Optometric Association and the foundation for us to continue this cause. And we want you to know that we still need your help. If you would like to contribute to the National Optometric Foundation, you can do so in the form of Cash App. We have a Cash App $ protecting the vision that you can donate to. The National Optometric Foundation wants you to know that you can follow us on Facebook. We have a Facebook page where you can get information about who we are. We have a website as well there, and we have a YouTube page channel that you can follow. Even tonight's show will be on our YouTube channel, and you can go back and watch the previous shows that we have done for this year, 2022. All right. So thank you guys for listening in. We want you to get some paper, get a pen, take some notes, because these doctors who I'm going to bring on the show tonight have some great information to share. They have years of experience in their field, and I want you to listen in to what they have to share. So go ahead and grab your favorite drink, popcorn, get ready, kick off your shoes, relax your feet, because this is going to be a show you do not want to miss. As we speak about men's health, we want to make sure that we're helping to protect your vision, make sure we give you information about how to prevent things from happening when it comes to your overall health. And these doctors are going to share with us tonight. So let's go ahead and introduce a doctor who is currently in Atlanta, Dr. Melvin Echols. He's associate professor of cardiology with the Department of Medicine and the Cardiovascular Disease Fellowship Program Director for Morehouse School of Medicine. Dr. Echols' primary area of focus is preventative heart failure cardiology and cardiovascular disparity research. Dr. Echols graduated from Morehouse School of Medicine in 2002 and completed internal medicine and cardiovascular disease residency fellowship training at Duke University in 2010. Dr. Echols provides care to a diverse population of cardiac patients and has focused research efforts on heart failure, quality improvement, and healthcare disparities. He's a member of the Association of Black Cardiologists, the American College of Cardiology, and Heart Failure Society of America, and serves on the National Heart Failure Collaboratory. Dr. Echols also serves on the editorial board of the Journal of Cardiac Failure and in the Journal of American College of Cardiology. Dr. Echols, you are a busy man, and I'm so glad to have you on the show tonight. Welcome to the show, Dr.
Thank
Echols.
you, Dr. Brown. Thank you so much for having me.
Absolutely, sir. We'll come back to you next so that you can share with the audience tonight. Thank you so much. Introducing our next distinguished doctor, all the way over on the West Coast, Dr. Larry Jones. Dr. Larry Jones attended the University of Washington, Seattle, 1975 to 1981, and received his Bachelor of Arts in Black History and Ethnic Studies with a minor in anthropology. Dr. Jones taught Black history with his father, Dr. Edward Jones, sorry, an author and professor. Dr. Jones also played football for the University of Washington Huskies. Dr. Jones received Bachelor of Science and Doctor of Optometry from the Pacific University College of Optometry in 1985. He has been working for a long time to help take care of eyes. Thank you, Dr. Jones. He's from Washington State Board, certified in 1992 as a hearing instrumental specialist. He's a member of the American Optometric Association and serves on the AOA Hall of Fame Committee, AOA AOSA Grants Committee, a member of the Optometric Physicians of Washington, and is on the Diversity, Inclusion, and Access Task Force. He's a member of the National Optometric Association for 40 years. My goodness. Dr. Jones is current president of the National Optometric Association and received in 2016, Dr. Jones got the Optometrist of the Year award. And Dr. Jones is current president of the NOA. He received that award, and he's also received the Camilla Prize for Distinguished Optometrist at Pacific University in 2017. He serves on the Pacific DEI Task Force. He's been a panelist for the AOA. He's been a panelist for the NOA, the AAA, the AAO for Children's Vision, Diversity, Implicit Bias, and Health Disparities. Dr. Jones worked at the King County Juvenile Detention Center for 3 years and examined over 300 juvenile offenders. He was on a team that changed Washington state law and will now make it mandatory to test children at near point vision in all Washington schools. Dr. Jones also works with veterans that can't afford eye exams in Washington and donate time and glasses to the homeless and underserved. Thank you, Dr. Jones. He has one of the largest Medicaid DSHS practices in the state of Washington. Dr. Jones, you, sir, have been a very busy man, and we appreciate you for your service. Welcome to the show, Dr. Jones.
Thank you so much. And I'm excited to be on tonight, and I'll try to keep that Mr. Positivity going.
Yes, sir. Keep it going, sir. We need it. We need that positivity.
All right.
We'll have you back on the show later to share with our audience tonight. Okay, let's go ahead and get our third guest speaker for tonight introduced to you all. I'm excited to present to you no other than Dr. Ronald Brown Sr. Here in Augusta, Georgia. He received his undergraduate degree in biology, honors from Ashland University in Ashland, Ohio. He received his medical degree from New York Medical College. His internship and residency training in internal medicine was performed at Emory University Hospitals in Atlanta, Georgia. He did his gastroenterology fellowship at the Medical College of Georgia from 1982, when I was born, to 1984. He is board certified in internal medicine and gastroenterology. He has practiced medicine, specifically gastroenterology, in Augusta, Central Savannah River area since 1984. He's provided gastroenterology care for many of the indigenous population in Augusta. He served as the chairman of our deacon ministry at Tabernacle Baptist Church, and he's a member of our medical ministry, of course, Dr. Brown, and we're so glad to have him on there. He's been selected by his peers to the Augusta Magazine's Top Doctors in Augusta, Georgia since 2006. What an honor. He's very active in community affairs. He has volunteered for numerous health fairs and forums. He's active at the Boys and Girls Clubs of Greater Augusta and serves on the board of directors. He volunteered for Habitat for Humanity. He and his beautiful wife, Mary, his high school sweetheart, I may mention, have been married for 43 blessed years and have 3 sons and 4 grandchildren. He enjoys bicycling, gardening, restoring antique cars, line dancing, and mentoring. Dr. Brown, my goodness, what a bio you have. Welcome to the show. I'm so glad to have you on the show tonight.
Good to be here, Dr. Brown. I've only got one disclaimer, and that is Dr. Timothy Brown and I are not related. because Dr. Brown is well informed, he's well connected, and he's wealthy, which I'm not, but I'm happy to be here.
Thank you so much, sir. I appreciate you for being on the show, and we're going to bring you back to share with our audience tonight. I can't wait to hear what you have to share with them. Thank you so much. So, guys, thank you for listening as I introduce our three distinguished guest speakers for tonight. I want you to tune in as they share about what is the importance, why is it important for men to have their exams at their practice, and why should men always make sure that they keep the cardiologist, the gastroenterologist, and the optometrist on their yearly schedule for appointments there. So I'm going to go ahead and bring on our first guest for tonight, Dr. Jones. If we could bring in Dr. Jones to talk with us about the importance of men getting their eyes examined and touch upon some things that you feel are important for men to know when it comes to their eye health. Dr. Jones, welcome back on the show.
Thank you so much, Dr. Timothy Brown. First of all, it's an honor to be on this show with such, awesome people. I mean, I'm excited. I'm totally excited because this is a great opportunity for us all to learn. I'm looking forward to hearing what Dr. Eccles says in cardiology, because that's one of my things. I'm taking high blood pressure medication. I got to know what I'm supposed to do too. And then Dr. Brown, the GI and internal medical and internist, and he's an expert there. So we need to hear all these neat things. So I'm so excited. And also, number one, for the brothers that are dads, happy belated Father's Day. And number two, well, actually, really number one, too, happy Juneteenth.
Yes.
So we are celebrating for people of color, a Freedom Day that the Texans found out a little later. It wasn't our real Freedom Day, but we know that. We know the history. Yes. But I just want to say, looking forward to that. I've been dealing with a lot of interesting things as far as medical mistrust, implicit bias, those things that don't allow men to actually want to come to see the doctor. So right. Especially men of color, when we come in and see the doctor, we feel if the doctor's white, if he's not the same color, even some black doctors, two black doctors, because we have implicit bias toward each other sometimes, which people don't realize that. And so that's something that we teach. We have to work on that. That implicit bias that hits the limbal part of your brain, and you react in a parasympathetic way when your brain is overextended and your cognitive is overloaded, we react differently. And so as doctors, those things kind of push our patients away from us, those reactions. And I don't know about y'all, but when I go in, I have my little meter up and I can tell if somebody's reacting differently to me. Right. I just recently had surgery and I had it on my ankle, and something happened during my surgery. I was out. So I don't know what happened. I called and talked to my physician and said my lip was swollen when I got done, and I don't know what happened. And so that made me a little cautious about, even trusting, myself, trusting other people. And these were Europeans that were doing the exam, not to mention, could have been anybody. But anyway, men see going as a doctor as a weakness. So sometimes that we don't do those things that we should. Getting to the doctor is almost like pulling teeth to us sometimes as men. We think we're Superman. We have those feelings of, I'm not supposed to tell anyone I'm hurting. I don't want to tell anyone what's going on with me. And a lot of times if you're having symptoms, for example, with your eyes, or you're having headaches, you're having, pains in your shoulder, in your chest, things like that. These are signs that we need to really recognize that could be life-ending. And so with us as optometrists, we're kind of the primary, as Dr. Timothy Brown said, the gatekeeper of what we do health-wise. And we basically see, primary healthcare needs where people just come in because they can't see. And it can be a myriad of things. So a lot of times they come in and they can't do things at their job and they can't see, and they can't do this or that. They can't drive, they can't read. And so that this gets them in across our threshold. We keep them across, when they come across the threshold, we have to open our arms up and reach those levels of relationship with them so that they feel comfortable with us. I always, when someone comes into my chair and sits down in my office, I say, sit down in the king's chair. You're the king today. And they kind of laugh. And I say, no, I'm going to treat you just like my brother or my father, depending on their age. And when I speak that, they believe me. And if I act any different than I think I should, if I go a little fast or don't let them speak, 11 seconds is the average time a doctor allows a patient to speak. And after 11 seconds, we stop them and we start talking.
Wow.
So we need to learn how to get over those things, basically. As an optometrist, we make sure that we see people with diabetes, high blood pressure, glaucoma. Those are regular yearly exams that we do. We call those the 3 silent killers. I will leave the pathophysiology of diabetes and hypertension to the experts who are in the other chairs about to come up. And I'll talk a little bit more about what we see as optometrists when you come into my office and what I do with you. So the first thing that we do as an NOA doctor, we are focused in on diabetes, high blood pressure, and glaucoma. Those are called the 3 silent killers. And so as we look at diabetes, it's one of the most devastating diseases as far as of people of color. And we suffer with diabetes majorly more than the average population. And the virulence of diabetes attacks our bodies and creates so many complications, from all the way from neuropathy to amputation to death. And so when we see a patient that has, let's say, their A1C or their blood sugar has shot up and they know their numbers or they don't know their numbers, we need to, as doctors at first, really take that into consideration and start doing research to help this person to make sure that they're on the right track. So as an optometrist, I always ask my my diabetics to come in yearly that have been diagnosed with diabetes. I dilate their fundus. I look at the back of their eye. We make sure that the tissue in the back of the eye is healthy. We can take pictures, fundus photos. We can do optical coherence tomography that can see the depths of the retina. There are different tests that we can do to actually diagnose different levels of diabetes. Generally, the first thing that we'll see after years of diabetes, and it couldn't be 5 years, it can be 20 years, but if they're diabetic retinopathy or if their eyes are changing rapidly, it's a sign that their blood sugar is going up and down. We can start to see small hemorrhaging in the back of their eyes, and that hemorrhaging can change to larger hemorrhaging, and it can change to blind spots, and literally they're slowly going blind if they're not taking care of their diabetes. So these are things that we can diagnose and see right away, which other professionals, so the primary doc is looking for a report for me right after I see that patient and sending them the information. If I do see retinopathy, depending on how many hemorrhages I see and in what quadrants they're in and the number of hemorrhages I see, I can actually, report this to him. And actually this will give them an idea that they need to up their game on what they're doing with the medications that are being given. And if they need to go from metformin, maybe to insulin. So these are things that we do in concert with our primary docs and with our doctors like Dr. Brown, who are the tertiary doctors and the specialists in this area. Again, we make sure that all of these things are taken a look at. If a patient comes in who's a brittle diabetic, which means that their blood sugar is jumping up and down and it's uncontrolled, we want to really make sure that they're followed and that we make sure that we follow up and make sure that they've gotten to their appointment. I had a young Samoan patient the other day who came in, and he had hemorrhaging in all 4 quadrants, and they were fairly large hemorrhaging. It was just, his eyes were a mess, both sides, and his vision was literally going down almost as we spoke. I referred him directly to a multi-care, which is one of our community service hospitals. And I called them ahead of time. I probably should have driven him. But what happened is, he's a big Samoan guy. They wouldn't let him in. The security stopped him, and it turned him around. And he said, I don't want to go through, I'm tired of people not respect, the whole thing happened. And so I totally followed up and had him go to a different doctor. But it's funny how a little bit there's racism happens in every circuit that we're looking at. We have to understand that this is something that we battle every day. Even in our health, we need to make sure that we're taken care of by people who care about us. And that's what I try to put forth with my patients when I see them. Diabetes and hypertension go together sometimes. So high blood pressure, when a person's blood pressure is over 130, 140 and higher, and their systolic and diastolic are raised up, we know that these are signs that we need to look in the back of their eye and see whether their arteries and veins are nicking and crossing each other. We can actually look, and within seconds, we can diagnose what level of hypertension they are in by if they have flame-shaped hemorrhages, if they have, right angle crossings, different things that we can see in the back of their eyes. Within seconds, we can diagnose high blood pressure even without taking their blood pressure, which is interesting. So it's so important for us to do dilated eye exams on patients, make sure that we follow up and make sure that we're doing the best that we can, and know that we understand that the CDC says only 50% of the people have controlled, and I won't go into the deep numbers because I'm sure that Dr. Eccles probably will have the numbers a lot better than I do. But I know that there's a lot of uncontrolled and uncompliant people out there that aren't taking their meds and that they're not controlling those things. And so we're looking forward to, and we know African Americans have a higher probability of having more problems again in this arena also. And so we know also that when people have hypertension, it can also create a problem with hypoxia with glaucoma. So we know that leading into glaucoma, glaucoma is a disease of the optic nerve, and we know that it's a vision loss. It's one of the silent killers, one of the 3 silent killers that we talk about in the NOA, and it's one of the leading causes of irreversible blindness. And over 3 million people right now have glaucoma in the United States, and we know by 2050 it'll be 6 million. So we need to really work on screening and doing visual fields, checking for high pressure in open angle glaucoma. We know angle closure glaucoma has a higher probability of bringing people in because it becomes painful. And there's, and we know that people that have certain vision problems, for example, if you're really, really nearsighted, then you can have severe myopia or nearsightedness, that you're a higher probability to have open angle glaucoma. And if you're farsighted, you have a higher probability of having angle closure glaucoma because of the way the angle inside of the anterior chamber is, and the older age and family history, eye surgery or injuries can cause secondary glaucoma. And then normal tension glaucoma is some of the most dangerous because, again, a silent killer. We take the pressure and you have normal pressures, but actually with cardiovascular disease and a family history of glaucoma, you can have normal tension glaucoma. So those are things that we look for when we're testing and we're looking at patients. And we know glaucoma is from age 45 to 64, glaucoma is 15 times more likely to cause blindness in African Americans than European whites. So really super important that we do get eye exams, that we get checked up, that we make sure that we are coming to our yearly eye exams. Such an important thing. And so I think that's it. Thank you so much. Yes.
Dr. Jones, so it's not all about going to the eye doctor and just getting my glasses or my contacts. You mean you guys really can look at and see things that may be affecting my overall health when it comes to my blood pressure, see if I have diabetes or if maybe something's going wrong with cholesterol or
Yes,
cancer.
sir.
Wow, that is
Yes.
very encouraging, and men should be aware of these things and knowing that it's important for you to get your eyes checked because, as you just heard Dr. Jones say, even your optometrist can be the gatekeeper to helping getting you connected to your primary care doctor, or you may need to go to the emergency room,
Exactly.
depending on what condition they may find the back of your eyes when you're dilated and they check the retina. So good, Dr. Jones. Thank you so much for highlighting all of those great things there when it comes to men getting their eyes examined and why it's important for them to get their eyes examined and how often they should come and see an optometrist for their eye exam. Dr. Jones, I know that you will continue to lead well the National Optometric Association, and I know you're excited about the upcoming convention over there in California, where you guys are going to be able to do vision screenings for communities over there as well. I know we don't have a lot of time on the show to go in detail, but can you just briefly, about 2 minutes, tell us about those vision screenings that you all were going to be doing for the community?
So every year when we go to our conference, we do a thing called Serve Where You Go. And we basically see probably 200 to 300 kids and adults a lot of times, and we get them glasses in conjunction with VSP. So Vision Service Plan supplies the glasses. They bring a van there that actually helps us. They actually make the glasses there. They do about 30 pairs on site, and then they give coupons or vouchers to the kids and adults that can't get the glasses that day specifically. And then we do screenings on them to all, just like I was saying, we screen for 270 different diseases that can be seen in the eye. And so with our screening there, we've done it every year for, I think, close to 20 years. I've been doing it any way that I remember. Boys and girls clubs, we go in, and sometimes churches, different areas we go in, and we just find an area that we can serve and we go for it. And it's really a good time, and people are very appreciative to get their eyes examined. And we can do almost a full eye exam there, which is pretty cool.
I'm looking forward to seeing pictures and hearing about the outcome with that. I had a great time with the NOA in San Antonio, Texas, when we were there serving the community, doing eye exams, and people got their glasses. It was a great turnout there. So I know in Anaheim, California, it's going to be another great turnout there coming up here in July. So thank you so much for sharing, Dr. Jones. Thank you.
You're welcome. Thank you.
All right, let's bring on, as we talk about the eyes, let's go on down to the heart and bring in Dr. Echoes there so that he can touch upon some of the things that Dr. Jones may have already mentioned to us when it comes to men and their health. Dr. Echoes, thank you again for being on the show, and welcome back to the show. And I'm just going to leave it open for you to share some nuggets there with us tonight for men's health.
Yeah, great. Thank you so much again for having me. So, I think the best way to describe cardiovascular health to men is to get them to see that, over time, we all change. Over time, we grow, we get older. Many men think that they can still do the same thing that they could in their teens, in their 40s and 50s. And some of us quickly realize that we can't. And so I think that people should understand that over time, your body deals with a lot. So it deals with a lot of what we call socioeconomic stressors, environmental stressors, and things like, stress from jobs and what have you. Over time, your eating habits tend not to be the best. And particularly for people, sometimes you can actually gain weight. You can actually start having issues with blood pressure. And this is where we start having, issues in terms of cardiovascular disease. Now, when you talk about cardiovascular disease, it is a broad term that means a lot of different things. I think one of the most important and most deadly cardiovascular disease that we talk about is actually high blood pressure or hypertension. And you may ask, well, why is that so deadly? Well, it's actually deadly because oftentimes people actually do not actually have symptoms. So, as was stated before, it's often the silent killer. And many people can walk around with blood pressures in the 180s, 190s for years without actually knowing that they have a problem. And that tends to be an issue because over time that can actually damage your blood vessels, not only your blood vessels in your eyes, but your blood vessels in bigger arteries and vessels as well, and can cause things that lead to diseases or conditions such as heart failure or stroke. Now, in my role, I am what we call a preventive heart failure cardiologist. And so basically, I am emphasizing prevention first and foremost for all cardiovascular disease management. So that means long before you actually develop the heart failure, the strokes, the other debilitating diseases, we try to actually cut it off at the pass by making you realize that prevention is so much more, quality of life saving than actually dealing with a disease after the fact. Now, when we say, well, what are the things that we can do for prevention? So there's the American Heart Association actually has a concept that's called Life Simple 7. And Life Simple 7 actually deals with 7 different types of risk factors that you can have that over time, if you try to change or improve some of these risk factors, it ideally improves your cardiovascular health. And the very first one is actually manage your blood pressure. So I think at the first and foremost, people just really need to know what their blood pressure is. Just in general, when we talk about blood pressure, people often don't know the numbers. And a lot of that is actually due to the medical society, because over time, the blood pressure numbers for what is considered high blood pressure and not has actually varied over the years. And so sometimes it can get confusing. Some people still think that high blood pressure is defined as blood pressure of on the top over 140 and on the bottom over 90. But about 2017-18, there was a change in this actual definition, because what we realized is that any blood pressure over 120, now that's very important, any blood pressure over 120 through time actually can increase your overall risk for strokes and cardiovascular disease. And so what we now have said is that normal is actually a blood pressure that's less than 120 on the top and less than 80 on the bottom. And oftentimes in our community, a lot of people see blood pressures of 109 or 110, and they think, oh my God, that's low. And we just have to kind of change the ideal of or the expectation of what, to see whenever you take those blood pressure numbers, because that indeed is not low at all. I think that, the other issue is, so that, elevated blood pressure, as I said, now is actually 120 to 129 on top, and 80 to 89 on the bottom. And then you have actually stage 1 hypertension, which is actually greater than 130 on the top and actually greater than 80 on the bottom. And so just in general, I think that, what we have to understand is that blood pressure numbers have changed over time, but they have changed because it is crucially important to try to control those numbers to actually prevent issues in the long run in terms of, cardiovascular outcomes. The second part of the Life Simple 7 is actually control the cholesterol. And, this one is a little bit tricky just because cholesterol, actually, the cholesterol level in your blood actually is basically contributed to by several different things. And that could be the food that you eat, but also it can also be your family history or your genetics. And some people, eat relatively clean and they still have very high cholesterol. And I think that's important to people understand that sometimes it's not what you're eating. Now, guaranteed you have to eat healthy. But again, still people can have problems with cholesterol. And so what we have realized is that by lowering the cholesterol, lowering the amount of cholesterol in the blood, it actually reduces the amount of cholesterol that is able to inflame the cells that underlie the vessels. And essentially what ends up happening is, when cholesterol inflames the cells and the vessels, you can actually get what we call cholesterol plaques. And so cholesterol can actually seep in between the walls and the sort of layering, the inner layering of a vessel, and then obviously start causing a plaque. And over time, this plaque can grow and grow and grow until you have what we consider a blockage. And so that's basically, if you were looking down the barrel of a vessel, you could see that there's sort of a little hump here that basically is caused by cholesterol uh, implantation up under the wall of the vessel. And through time, that can get quite large, and sometimes that vessel or that little plaque space can actually become more inflamed and break off, and little parts of it can start traveling down to the end of the vessel in the heart, and that's when we have what we consider heart attacks or myocardial infarctions. And those things are not fun to have, So as a cardiologist, we manage people who come in with heart attacks all the time. We actually see people who have very severe heart attacks that unfortunately don't make it to the hospital, because one of the very first signs of cardiovascular disease or acute coronary syndrome is actually death. And so that means 50% of people who actually have this happen for the very first time in life don't make it to the hospital. And so that's why it's so important for us to control these numbers and try to prevent things like elevated cholesterol and high blood pressure. You also have, issues with people who have heart attacks that don't even know that they have heart attacks. So people who are dealing with things like diabetes, you actually tend to often have, you can have, what we call silent heart attacks, or heart attacks that are associated with just sort of prolonged standing of poor blood circulation to the heart muscle. And both of these can affect men in various ways. And I know I'm young enough to realize that I remember Fred Sanford and Sanford and Son, and how when he would describe a heart attack, he would grab his chest and say, "Oh, Elizabeth, I'm coming to meet you." And in actuality, heart attacks don't necessarily have to look like that. Heart attacks can be just an increased shortness of breath that's out of proportion of what you normally are facing, and something where you just know something's not right. So it doesn't always have to be chest pain. Women particularly don't always have to have that traditional chest pain. And so that's why it's very important to know your body and to know the symptoms that happen to you, what's going on. Other signs and symptoms of a heart attack can be sort of, increased pressure in the chest, or increase just cold sweating for no apparent reason, nausea, vomiting. Some people can actually vomit, and you can actually have pain that actually either radiates down your arm, your left arm. But, those are traditional typical factors, but it can be anything. If it radiates across the chest, if it radiates down both arms, or through the chest, from the chest to the back, these could also be signs and symptoms. So the best thing I can say is, when you have, if you ever, God forbid, if you ever have signs or symptoms like that, the best thing for you to do is go to the emergency room, because you can't tell what's going on. You can't do EKGs on yourself. And so for you to sit and search Google in terms of what is happening, I don't think that would serve you well. So when in doubt, go to the emergency room and get checked out. The next thing is actually reduce your blood sugar. So as has been alluded to, diabetes, again, is another silent killer and can affect multiple systems. We think that, in general, people should pay attention to what we call now their hemoglobin A1C. And so basically that's a test that actually tells you whether or not you are having higher blood levels of sugar circulating in your body over a 3-month period. And, when you ask, okay, well, how does that work? Well, basically what happens is if you have a higher level of sugar in your blood, it tends to grab onto your red blood cells. And so we can tell that in terms of this number by telling how high that percentage is. And we really want to see people who have hemoglobin A1Cs less than 6. That's actually good. But whenever you get to 5.5 to 6, you're starting to, increase up there into where we discuss this as being possibly insulin resistance. And then past 6 and beyond, that's when we start talking about prediabetes and diabetes. Diabetes is a very devastating issue. I grew up in the South, and you grew up in North Carolina, and we actually, had great soul food and all of these things. And oftentimes you would see people who either, had heart attacks or strokes or got hands, or I mean, not hands, but feet or legs cut off because of diabetes. And so over time, it has become incredibly important to know your numbers. And the hemoglobin A1C is one of those where you must know your numbers. And also take your medicine, which, again, we can talk about a little later. The fourth thing is actually get active. And so again, like I said, as time changes, you realize that you're not the young man that you thought you were, and you tend to be a lot more sedentary. And so basically you go to work, you work hard, but then you come home and you may, eat a good meal and go to sleep. And all of that is really sort of counteractive to your body and your metabolism. And, I'm in my 40s now, and I can definitely tell you when I hit my 30s, I started sensing something wasn't right in terms of metabolism, and then even more so in the 40s. And so it's definitely a struggle to try to kind of keep yourself balancing and get exercise, especially when you're working a lot and you're tired, and, there are a lot of stresses, but you have to make time for it, because if you make time for it, that actually hopefully will prevent worse things happening in the future. And along with these, staying active, we also want you to lose weight as well. Lose weight and eat better. Again, eat better means different for different people. I think for most people, you should really consider trying to stay away from processed food, such as quick, easy foods that you can eat on the go, like lunch meat and things like that, because they actually are full of sodium, which also can contribute to the high blood pressure, but also can just contribute to the weight gain and poor nutrients. And that also is an issue as we talk about decreased metabolism and gaining weight. And so we've talked about, eat better, get active, lose weight. For the most part, everybody can stand to lose a little bit of weight, unless you are an athlete at 60. But you know your body, and you probably should be real with your body. There's nothing more humbling than looking at your body in the mirror and realizing what it looks like versus what it did. So I would implore you to really try your best to be the best you, if possible, and try to lose weight and try to eat more healthier. And these all actually help to prevent worse cardiac issues down the line. And then the very last, which is hopefully many of you are not doing, but it's smoking. Stop smoking. I often tell people, particularly when they come in for heart attacks for the first time, I can throw all kinds of the best medicines at you all day long. You can take everything that you are possibly, supposed to take, do everything that you're supposed to do, get checked out every day, and that still won't do as much good to your body as smoking does harm. And so essentially, it does not matter what we do, if you're smoking, because smoking actually portends a significant harm to your body over time. And I think people get confused because you see people who live until they're 90, 95, smoking, like a chain smoker every day, but that's not always the case. And whether or not you develop, issues from cardiovascular disease is one problem, but the other issue is lung disease. I have asthma, and there's nothing worse than actually having shortness of breath and not able to do, walk down the block because you're short of breath. Smokers do this all the time. They actually, have these horrible coughs and this poor exercise capacity, but they've been used to it for so long over the gradual period that they don't notice it's a problem. And I love when I have people who, after they've had heart attacks and they stop smoking, they come back in a couple of weeks and say, wait a minute, I am breathing so much better than I thought, I could. And that just kind of is positive reinforcement for people to really start watching these risk factors and to take care of themselves. And so in a nutshell, those are the seven sort of life simple seven things that I think people can relate to. I'm pretty sure that there are a couple in the audience that have at least one or two or probably all of these issues that they probably need to work on. But again, this is a work in progress. I often tell my patients it's one day at a time. You didn't get this way overnight. You're not going to, become Superman overnight. So you have to make smart choices one step at a time. And over time, these habits build up to improve cardiovascular health.
Wow, Dr. Echoes, I love the way you unpack all of that important information as it centers around men's health. Things that they should recognize there when it comes to their blood pressure. And if it's over a certain number, I think you were mentioning saying over 120 over time, that can increase their risk for stroke and cardiovascular disease. And how sometimes, genetics it is genetics. It plays a factor into who we are and how we're going to be when it comes to our health and regulating our cholesterol, and how if you don't, it can cause plaques to build up in your vessel there and lead to a heart attack, and those signs and symptoms. I love what you say, when in doubt, go get checked, go to the ER. Don't sit there trying to Google, your signs and symptoms there. Go get checked so that if you are having these things that's very serious, you can get help before, it causes death. Pretty much there, it's a very serious condition. We're not here to scare anyone. We're here to educate and encourage and inspire you to don't delay. Do it today. Go get checked. Go see your physician. Get your health examination done and get it checked off of your list for 2022. Dr. Echoes here is a great cardiologist, and he just laid out those outlines there on your health and why it's important for you to even keep your blood sugar regulated and making sure your A1C level is not high there as well there, and making time for staying active, making time for losing weight, making sure you lose weight, making sure that you're that you're following a healthy diet there as well. And most of all important, stop smoking. That's important. Stop smoking. It's going to decrease your risk for cardiovascular disease. It's going to help you feel better, you breathe better. You're definitely going to smell better. So thank you, Dr. Echoes, for outlining those things there. I think that's very important there. And I really appreciate you there for sharing your knowledge with our listening audience tonight there. Thank you so much.
Great. Thank you.
Yes, sir. And so as we go from the eye health, heart health with our cardiologist, our optometrist told us about our eye health. We are now bringing on Dr. Ronald Brown Sr. to talk about gastroenterology there and to highlight some things, Dr. Brown, that you feel is important when it comes to men's health. Me just I'm thinking about maybe acid reflux. I'm thinking about colon cancer. I'm thinking about diarrhea, constipation. You're the specialist, you're the doctor in charge. So I'm just going to leave it open and let you share some golden nuggets with us tonight. Thank you for being on the show, sir.
Thank you, Dr. Brown. Obviously, I'm a gastroenterologist, and I'm responsible for the esophagus, the stomach, small intestines, the liver, gallbladder, pancreas, and colon. That's about 7 organs, but sometimes the last shall be first. And so with that, I'm going to talk about the colon a little bit tonight, because guys, you should know this because you're significant and you're special. March is Colorectal Cancer Awareness Month, according to the American Medical Association. But I say that every month should be Colon Cancer Awareness Month. When you know better, we do better. Colon cancer is very common in the United States. As a matter of fact, it's the second most common cancer in males and females, and responsible for the third most common cause of cancer death. 1 out of every 18 Americans will be affected during their lifetime. 1 out of 18. There are at least 140,000 new cases diagnosed every year, and 50,000 people succumb to this deadly disease. But here's the good news. It's preventable and it's curable. It's preventable and it's curable. Here are some of the risk factors that you need to bear in mind. You've heard some of them already tonight. Age is a factor. So the older we become, not only do we lose muscles and strength and speed, we also are at risk for developing colon cancer. We're guilty of this in our community. We just don't know our family history. And this is very important, so that when we see people at the time of their exam, we want to know, is there a history of colon polyps, colon cancer, because that increases your risk, and it causes us to start screening you earlier for those diseases. So think about that. We need to know about your past medical history personally as well, because, for instance, in terms of colon cancer, people with inflammatory bowel disease or Crohn's disease or ulcerative colitis are at increased risk above the general population for colon cancer. We've heard about diet tonight as well, and red meat should be number one on the list of things to try to avoid when it comes to colon cancer. So really limit the amount of red meat that you're consuming. Obesity is also a factor, and maybe Dr. Eccles can chime back in at some point, because I think there's a difference between having pair obesity versus having upper body obesity in terms of putting you at an increased risk in terms of cardiovascular disease as well. Smoking, we've heard about it, and for colon cancer, it is there as well as diabetes. Obviously, if you had a history of colon polyps, then you are at increased risk. We've identified certain things and foods that decrease your risk for colon cancer. Fish, as opposed to red meat, calcium, dairy products, vitamin D, fruits and vegetables, increasing the fiber in your diet and also increasing the water in that diet. Selenium. We also think that aspirin and non-steroidals, but say that with a little trepidation. Dr. Eccles may chime in at some point, because they've noticed that with those, you shouldn't be taking those excessively to prevent colon cancer, because I'm concerned about GI bleeding. So think about that as well. Colorectal screening is the key. Screening for colon cancer is probably the best, or one of the best, that we have, compared to even pap smears, mammograms, PSAs for the prostate. Colon cancer screening ranks up near the top. For a long time, we said the number was 50 years of age when you should first begin the colorectal screening. And it was changed to 45 for African Americans about 10 or so years ago. Guess what? Now it's 45 for everyone. And I can't wait until they change it to 40. But right now it is 45 years of age for everyone. And it is the most effective procedure for detection of colon cancer. And it's important. For instance, during my practice career, I've identified or took care of two patients that I think about often. One was 29 years old male. The other was a 33-year-old male who played basketball in college. When I saw them, they had metastatic colon cancer, and one lasted maybe 6 months, the other maybe a year. So colorectal screening is very important. You can begin before 45 years of age if you have change in your bowel patterns. And what do I mean by that? Well, if you are a once a day person, and now all of a sudden you are once every 2 days, that's a change. If you're going once a day and now you're going 3 times a day, that's a change. And that should be brought to the attention of your primary physician, and certainly be referred to your gastroenterologist for further evaluation. Obviously, if there's any bleeding, whether it's gross bleeding or if it's microscopic, detected by card tests, you should undergo colorectal screening. If there's significant weight loss, that's also a cue to be checked for it. Abdominal pain, although less specific, is also a factor in our determination to screen you. Certainly, any anemia, specifically iron deficiency anemia, we'll ask if you have that. We will be checking to make sure there's no seepage of blood from the GI tract. Some of these, like perforation, migratory thrombophlebitis, which are clots in the lower extremities, or ascites, or increasing fluid in the abdomen that increases the girth of your abdomen. and one bacteria, Streptococcus bovis, if that's detected in the bloodstream, alerts us to check for colorectal cancer. But any of these symptoms, you should be seeing your primary care physician, and he should be referring you to a gastroenterologist. And let me just say that when you see a primary care physician, just understand that that should be the beginning of a relationship. I heard Dr. Jones mention 11 seconds. Gentlemen, young men, if your primary physician or your gastroenterologist is only giving you 11 seconds to speak, you need to remember you do have a patient's bill of rights. And I would suggest that you fire that person immediately. It's a relationship, and you have a gift of discernment. I tell my staff, and I tell myself daily, that patients don't have the degrees that the panelists and I have, but certainly a dog, a cat, a young person, and a sick person can look in your eyes and tell if you care. So if you look in your primary physician's eyes, you don't see caring, or your gastroenterologist's eyes and you don't see or hear caring, then remember the Bill of Rights and fire them and find someone who does, because they are responsible for providing you the information after they've received it from you. A physical exam is absolute. For primaries, it should be every year. I tend to see my patients on a yearly basis as well. And remember that from a GI standpoint, a physical exam is not complete until he does a digital rectal exam. Gentlemen, I'm talking about a finger wave. And during that, prostate cancer is also very high on the list of things that we can detect early. And so your GI guy, as well as your primary care physician, can give you a heads up on whether or not a lump or a knot is felt and can get you carted off to a urologist for further evaluation. And gastroenterologists, as well as your primary, should come up with a plan and then a plan of treatment. They should tell you exactly what they're thinking, how they're about to determine what's going on. In this case, whether or not we think you need to be screened for colorectal cancer, and then following up with that with you. So we can as well do testing of your feces by checking for blood. There's some also there's the Cologuard test, which is a test that detects DNA in the stool as a harbinger for colon cancer. That's done ages 50 to 85, but the colonoscopy is the preferred test. Let me just say, guys, that don't get nervous when we mention the word colonoscopy, because I tell my patients, you don't know nothing, care nothing, feel nothing, hurt nothing, or remember nothing. It's really not a bad thing. Obviously, I'm past 60. I still think I have it. I've had at least 4 colonoscopies. And you have to know that it can't be bad, because I couldn't do myself. So I had to go to someone else who I trusted and had that procedure done. So I recommend that for all of you. There are other screening tests, but for instance, the barium enema is an x-ray test, but it's not as sensitive as colonoscopy. There's a capsule that can be swallowed, but I prefer colonoscopy. There's CT scan as well. I think you have to worry a little bit about radiation with that. But if you're at a place and there's a gastroenterologist there, then I would recommend that colonoscopy. Procedure is about 12 minutes. And like I said, it is not uncomfortable at all. And you should expect at the time of that procedure that it's going to be private. It's going to be confidential. You know, we're practicing under the HIPAA, which is the Health Insurance Portable Accountability Act. So that's confidential. It's pleasant, and it's a receptive experience. It's very safe procedure. And you get a lot of information out of that. So just think about that. And I also would echo that I heard tonight that when you do go to see a gastroenterologist, really even a primary care physician. I would say, except for Dr. Eccles and all, and Dr. Jones, you may want to take a female with you. It could be your wife, your significant other. It could be your child, aunt, grandmother. I've found that when a female accompanies a male, not with me, but with others, that they get a lot more information, and that increases your level of care with physicians, especially some physicians who may see you as sons of Hercules and become a little fearful and only give you 9 minutes or 9 seconds to speak. That might increase the time that you're in that exam room, so that as much information as can be gathered about you so that they can do the right test on you. But that's what I would suggest, especially when you are looking at primary care and even gastroenterology care. But just remember that you have to know that your body is a temple. And so you don't get any new replacement parts. So you have to take care of what you have. And prevention always is the best cure. So we encourage that. Now, I will do colonoscopies after removing polyps between 3 to 5 years. They're recommending that if you're completely normal, that 10 years. But obviously, if there are any symptoms, then you should clearly bring that to your gastroenterologist's attention, because sometimes there could be a mislesion. And going back earlier than the 10 years could be outright amazing and rewarding for you. So those are kinds of things that you should keep in mind. Dr. Brown?
Yes, sir. Thank you, Dr. Ronald Brown, for sharing insight on why men should get their colon examined and why they should not be afraid. You also reminded us that during this exam, it's confidential, it's safe, you don't see, you don't hear, you don't remember. So there's no reason to be afraid, men, to get this done. Colonoscopy will give the doctor valuable information about your body. And he also suggested that maybe you take a female friend with you or family member so that they can help gather information from the doctor when it comes to your health there. And I agree, Dr. Brown. If a doctor's only giving you 11 seconds to speak, you need to consider getting another doctor. We should always be building relationships with patients, and we should make that a two-way connection and line of communication there. We get to speak and tell you what it is that we're finding upon examination, and then you as a patient should be feeling comfortable asking questions or just sharing your concerns with your physician, your optometrist there when you're at the examination there. So thank you, Dr. Brown. You unpacked a lot of great information, and I love that you reminded our audience that your body is a temple, and you need to take care of it and get in that exam on a yearly basis. Coming to see you as a well-known gastroenterologist there. He's in Augusta, Georgia. If you are in the local community and you need to see one, Dr. Ronald Brown will be glad to see you there. But if you don't see your gastroenterologist, get your colonoscopy done and make sure that you're comfortable with your health. You don't need to guess at it. I always say, if you don't go, you don't know, so make sure you get examined there. So thank you, Dr. Brown. If we could bring our panelists back on there, I want to go ahead and wrap the night up. Maybe there's something that you were able to think about and you say, hey, I should have shared this, I should have said this. Maybe there's some words of encouragement or inspiration that you would like to leave with our listening audience tonight. I want to give you a few minutes there to just have some final words as we're wrapping up this, because you guys have already unpacked a lot of great information, and I'm so thankful for you. And I want to encourage you to continue to do what you are doing within your community. And now here, on this platform, a lot of people are going to receive the knowledge that you share tonight as well. So thank you so much. And Dr. Jones, you let it off with the eyes. So if you have anything additional, some closing words, you can go ahead and share that with us at this time. We're on mute, Dr. Jones. If you can.
Okay, rookie Zoom mistake. Sorry about that. I'm on Zoom all the time. It happens so often. So just some things about getting men to the doctor. Make it easy for them. Help them prepare for it if you're the spouse, a partner, or a wife, or a loved one. Don't nag them, and offer your support in any way. Suggest like possibly a virtual meeting with your doctor first to meet him and find out about him. What's the obstacle? If there's an obstacle, always make sure that you find out what that fear is. We know that fear is false evidence appearing real. It's usually 93% of what the fear is unreal, and maybe 7% you can't stop it, we say. Get someone that they respect, a person of authority, to talk to them about coming to the doctor. Plan a date after the doctor's appointment. Go out and get some organic fried chicken. Go to organic soul food place. I'm playing, but I'm serious. You need to do something fun afterwards. Plan something to get them there. And thank you so much, Dr. Brown, Dr. Timothy Brown, and Dr. Eccles, for your information. Now I thought that Cologuard was all I had to do. Now I know I'm supposed to go and get the whole deal done again. Since I was 50, I thought, oh, Cologuard, that was fine. Thank you. Bless you.
Good. Thank you, Dr. Jones, again, for sharing your knowledge and for being on the show with us. And Dr. Eccles, if you want to go ahead and follow with Dr. Jones there and leave some final words there for our listening audience.
Yeah, I think that men should understand it's 2022 and we have to learn to, at some point in time, be aware of the power of vulnerability. Oftentimes in the African American, situation, we actually end up having a lot of people who think you're supposed to be this or you're supposed to be that. That's why, it's masculine. That's why. But sometimes just being vulnerable and checking out yourself, understanding your stressors, understanding the things that are affecting your everyday life. Sometimes it's just good to get vulnerable. And so if I could say one thing that I think is powerful for our African-American men is learn how to be vulnerable and be okay with it, because that's where the power lies in terms of your growth.
Absolutely. Thank you, sir. I appreciate that. And I agree with you 100%. And closing out with us, Dr. Ronald Brown, go ahead with some closing words, inspiration, or any additional information that you wanted to share with our audience tonight.
Doc, I just want to thank you for making this possible. I tell you, I've gone to another level by just listening to the other two doctors here and just watching them. And the audience need to understand what's happening. And that is, the knowledge is the power. And when you go to those visits, you should come back greater than you went in terms of that information that you've gathered, because that's what's happened already to me just listening. That should happen to each one of you when you attend or you go see your optometrist, your ophthalmologist, your cardiologist, all your primary care. Come away with something else that take you to the next level, because when you leave that encounter, you're going to be one of your very best physicians. And when you got to understand that. Now, and the other thing you got to understand that we haven't done so much as a community, but Dr. Brown is showing us it can be done. Teddy Pendergrass said we have to pass it on. And so we have to pass on what we just learned. And not only are we going to be helped, others are going to be, because we will be serving them. And for us to serve them, that just means it makes us great. It's about serving others. And that's what I've heard tonight. So thank you so much for sharing us with them. I just appreciate it. Thank you.
Thank you all. Thank you all for serving. Thank you for all that you do. And I'm sure that our listening audience so grateful to get the knowledge that you share there. So I hope you have a great evening. And I'm going to close out by letting the listening audience know who we are as the National Optometric Foundation. So thank you all again. And to our listening audience, I want to thank you for listening in tonight. We had great speakers speaking on optometry, gastroenterology, and also cardiology there. And I think they did a fabulous job. And we'll have a different topic next month on this show, Protecting the Vision. We want to ask that you go to our YouTube channel, and I ask you to go ahead and follow us on YouTube, follow us on our Facebook page, National Optometric Foundation. If you would like to donate to continue to allow the National Optometric Foundation to support young minds, people who are thinking about going to optometry school, they're currently in optometry school as part of our National Optometric Student Association. Maybe they are at an HBCU and they are thinking about going into optometry. We want to support them with scholarships, and you can support us and allow us to continue to do this by donating to our Cash App. We have their $ Protecting the Vision as well there too. We are a nonprofit organization, and we support the National Optometric Association there in various ways when it comes to community work, supporting our students in school, supporting other optometrists as well there. So thank you to those who are sponsors and donating towards the cause. And we want to encourage you all to stay connected to us and make sure that you don't delay. You go ahead and make your appointment today with your physician, with your optometrist, and get checked, get examined. It's very important. We want to help prevent anything negative from happening to your body. So men, go get checked. Thank you guys for listening. And this is Timothy Brown, treasurer for the National Optometric Foundation. And it has been a pleasure sharing these great guests with you tonight. And I hope you have a great evening. Thank you so much.